before entering the patient's room, I checked his chart or any doctor's orders. I provide for privacy by closing the door. Can you confirm your name and date of birth?
Garrett Lobdell, February 6, 1993.
Right, and I would check his wristband. Next, I would wash my hands. I'm Abby. I'm going to be doing your assessment today. Can you confirm what you're here for today?
Checkup.
Okay, and on a scale of 1 to 10, how would you rate your pain? 1 being no pain, 10 being the most pain?
1.
Okay, so no pain. Are you taking any medications?
Nope.
And do you have any allergies?
Nope.
No. Okay, looking at the patient, his skin appears to be healthy with pink undertones. The color is appropriate for his ethnicity. The skin appears intact. I don't see any lesions. Feeling with the dorsal side of my hands, the skin feels warm and dry, which is normal. The hair appears evenly distributed throughout the scalp. It is healthy and shiny. It doesn't appear to be thinning and balding at all. Checking for skin mobility and turgor, I will pinch the area under the subclavicular area. Right, it was easy to pinch, meaning he has good mobility, and there was no tenting, meaning his normal turgor. Moving on to the abdominal assessment. Have you ever had any history of gastrointestinal diseases or disorders?
Nope.
Urinary system?
Nope.
Diseases? How about reproductive system?
Nope.
No problems. Have you ever had any surgeries in your abdominal area?
Nope.
No? Have you noticed any changes in your appetite lately?
Nope.
Have you had any problems with nausea or indigestion?
Nope.
Okay. Have you realized any problems with urination lately?
Nope.
Are you urinating more frequently than normal?
No.
No, and you're not having any pain or burning with urination?
Nope.
Okay. Are you having regular bowel movements?
Yeah.
Okay, and when was your last one?
Today.
Okay. And have you ever had any problems with hemorrhoids?
Nope.
Okay. Have you noticed any blood or mucus in your stool or urine?
Nope.
Okay. And then do you have any reproductive system concerns?
Nope.
All right, I'm going to have you lay down flat. We'll do the physical assessment. Okay, so I'm going to pull up your shirt to inspect the abdomen. So the contour of the abdomen is a bit rounded. The umbilicus is midline. There are no visible masses or lumps. It appears symmetrical, and I don't see any vein distension or pulsations. The skin is appropriate color for his ethnicity. It appears intact. There are no lesions, and the temperature is warm. The skin is dry. First, I'm going to listen for bowel sounds using the diaphragm of my stethoscope. And starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. All right, bowel sounds were present. They didn't seem to be overactive or underactive. I'd say they were normal. Next, I'm going to listen for abdominal arterial sounds to listen for any bruise. Beginning with the aortic, renal, right renal, left renal. Moving down to the right iliac, right femoral, and then left iliac, left femoral. Right, and I did that with the bell of my stethoscope. I did not hear any bruise. Next, I'm going to percuss the abdomen to see if there are any abnormal sounds. Starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. All right, the sounds were tympanic. I didn't hear any dull sounds where there shouldn't be dull sounds. And lastly, I'm going to palpate the abdomen. Let me know if you feel any pain or tenderness. I'm starting in the right lower quadrant. And this is light palpation, so I'm only going about 1 centimeter deep into the skin, pushing 1 centimeter deep. I'm in the right upper quadrant, left upper quadrant, and left lower quadrant. Do you feel any pain or tenderness? Okay, no pain or tenderness reported, and I also did not feel any abnormal lumps or masses when palpating. I'm gonna put your shirt down. To finish my assessment, I would document any findings. I would make sure the patient was comfortable, and I'd let the doctor know what I found.